I'd like to introduce you to the first panel today, and we're going to move forward with how will blockchain infrastructure affect the healthcare ecosystem?
Under their picture? No, under their name, not under their picture. That would be impressive. Ted, you can sit under your picture.
Thank you, thank you. So let me call to the stage Professor Shada Alsalamah.
Yeah.
Thank you. So, Professor Alsalamah is a visiting scholar at the MIT Media Lab. She is working on the application of blockchain in healthcare. She holds a PhD in computer science with a specialty in healthcare information security and privacy, as well as a master's degree in strategic information systems. She's an assistant professor of healthcare information systems security at King Saud University and is the vice president of M Health Solutions Division of Myanmar IT. Let me introduce you to Dr. Alsalamah.
Thank you.
Let me call to the stage now Nicholas White, please. Nick is the CEO at Helix 3, which he's going to tell us about. He's working on a new startup that is designed to empower people to live healthier lives through meaningful data. Nick is a serial entrepreneur, having worked with multiple startups over the years, and is leading teams of engineers and business people to drive innovation in the healthcare industry. Nick White. And now let me ask Dr. Alan Jiang to join us. Dr. Jiang is the Chief Strategy Officer of XTalPi and is responsible for the company's strategic direction. He brings over 15 years of scientific and research management experience for the company, having worked for Genzyme and then Sanofi Genzyme. He was working in the areas of disease biology, focusing on oncology and genetic diseases. He was the director of Asia R&D strategy of the Sanofi Genzyme R&D Center, and is also a member of the translational medicine team, focused on strategic implementation of pharmacogenomics and biomarkers. Did I do okay? All right, thank you. Again, let me introduce Dr. Jiang. Okay. So, our first panel today is about how will blockchain infrastructure affect the healthcare ecosystem. It's a very broad topic, but we have for you today 3 experts in the field, people working either from the technology side or from the healthcare side. Let me start with Dr. Jiang. Tell us about XTalPi and how they are working on infrastructure for the healthcare ecosystem.
Yeah, so the company really, I describe it as a digital or algorithm-based technology company. They apply the algorithm from quantum physics and chemistry and machine learning, artificial intelligence. That's the foundation for the algorithms. But then the computing environment is a high-performance computing cloud. And so the problem they want to solve or help is the biopharmaceutical industry. Our entry related the question is the solid-state development. It's a part of the small molecule drug development, and then extended to drug design and drug discovery. That's the asset we can generate from the company is totally digital. So it's naturally is connected with the technology area, including the blockchain technology. So that's how has this inherited interest in the blockchain technology.
Very good. Dr. Alsalamah, please tell us about your R&D and the work you're doing in this area.
Well, I think of myself as a neutral person coming from academia. So normally you see people coming from companies trying, they have specific products and, they pitch for specific ideas. I come from a sandpit where I actually experiment with some of the very complex problems, and I'm very happy at the end of the day trying to solve those problems. So coming from that perspective, we use blockchain technology. I am a patient advocate, so I'm a patient myself, and I struggled a lot with my data. I call myself a global patient, having records in 4 different continents. So I believe there is a chance, today, using this technology to empower patients more than any time, more than ever. So because this technology is really impressive in the way it can enable that in a distributed way, that is the natural way of healthcare systems today and for the last decade, since that the systems were built and designed as silos. So we cannot change that fact unless we need to replace the systems, and the migration to new systems is another hassle. So that's one of the things that we work on. We try to empower patients in order to allow them to sit on the driver's seat and drive their healthcare outcomes and services and decisions. Now, the other thing that we work on is that how we can empower healthcare professionals. Because in most of the sessions I go to at the conferences, we mostly talk about the patient. So the other thing that we work on is how to empower the healthcare professionals to be able to not only provide healthcare services to the patients, but also to identify the deceased, to give dignity to those people. So that's a very neglected area or space where people don't care much about the deceased. So this is where we use blockchain in order to identify the deceased in disasters. The third aspect is how we can, use it to empower the healthcare provider. I come from the perspective of the the hospital, in order to help them as decision makers make the best decision about how to optimize the healthcare system. So I have 3 voices today, and wear 3 hats today to talk about that.
Excellent. And now, Nick, tell us about Helix 3.
Absolutely. First, I want to thank the folks at ZGC for inviting me here. It's a fantastic innovation center you guys put together, and very excited to be here. So, a little bit about myself and Helix 3. So, I've been working on a project for the last 1.5 years, and which is Helix 3. And what we're doing is we're enabling people to store, manage, and exchange their data in a very powerful way. Okay. We want to be able to enable people to pull data from various different sources that are already existing out there, whether it be your EMR records, whether it be your genetic data that's sitting at 23andMe, whether it be the activity data that's being collected from your wrist, from a Fitbit device or an Apple Health device. We've identified that there's going to be an increasing amount of data being compiled across all these different silos. They exist today, and they're not going to stop, but it's going to increase, which opens up vulnerabilities around security and privacy. So what we're trying to do is create a secure way to pull in this data into a digital twin asset, which would be controlled by the true owner of that data. And that's you and me. Okay. Now, of course, there's a lot of areas and challenges that need to get figured out in this space. Hopefully we can discuss some of those today. But all in all, we're building this platform to empower people to drive healthier behavior and move forward into a world, hopefully, where we see precision medicine become a true reality. And we no longer look at people as a general, in a general way, right, where one shoe fits all, because frankly it doesn't. So that's a little bit about what I'm working on. Yeah, we'll probably dive in a little bit more soon. So.
Very good, very good. All right. So let's start with the current healthcare ecosystem and where blockchain applications are already out in the ecosystem, working live in production right now. To the surprise of some of you in the room, there's actually blockchain in healthcare already happening. So let's talk about where blockchain in healthcare is right now and where you think it will be going in the future, say, next 6 to 12 months. Dr. Alsalamah, you want to start?
Sure, absolutely. Okay, so I'll tell you about the projects that I work on specifically to support or empower the patient, empower the healthcare provider, and to empower the healthcare professional. Starting with the patient, definitely my favorite projects. At the Media Lab, we work on 2 specific projects, one called Opal for Health, and the other one is called Healthy Blockchain. And they are very dear projects to my heart, and because I can relate to one of them, which is Healthy Blockchain. Healthy Blockchain is about designing a new blockchain platform that can help connect existing systems together in order to paint the full picture. Now, the problem I've been investigating during my PhD in the UK using cancer treatment and the Mlynar Cancer Center and working with doctors and cancer information, we notice a lot of problems when it comes to the interoperability, which is, relative to almost every single healthcare system around the globe. But there are specific problems when it comes to the flow of information for care continuity. Now, here is the difference. Different systems, different countries have ways of modernizing their systems, the healthcare system, and the delivery of the healthcare services. Some, they do it in a revolutionary way. Some of them do it in an evolutionary way. Revolutionary, meaning they're going to wipe the system and start something totally new. And some countries do that. In other countries, they do it, evolutionary, step by step, by keeping what's working and replacing what's not working. And I come from that side because that's more practical. People will not just discard the systems; they will still need to work with the existing systems, whether they're discrete by nature, when they were designed, or because they're legacy and they cannot afford losing that. One thing in healthcare we know about is that clinicians cannot afford losing the data when it comes to the treatment. They need to make sure the information is available at the point of care. So, coming from there, I designed a blockchain solution that can help connect legacy systems in order to paint the full picture around the patient. And it shows comorbidity, meaning if the patient is going through different treatment pathways or treatment conditions, then the doctors can actually share that information and get to know if any decision in one treatment pathway would interact with another one. So this gives a full picture and provides a shared care among the healthcare professionals. The other project we work on is Opal for Health, which is to use artificial intelligence and blockchain in order to help population-wide information. And in Healthy Blockchain, we use the individual information to design a blockchain for that individual patient to provide patient-centered care. And Opal for Health, we try to use artificial intelligence in order to visualize in a very smart, intelligent way data of population-wide to help to allow the healthcare professional, healthcare provider as a hospital to make the right decision that is visualized. When they see reports, annual reports, then they have a problem visualizing it and making the right decision. I'll give you an example how we do it. I took a data set from the Ministry of Health in Saudi Arabia that shows stroke and MI cases of patients going from seeing the symptom of the stroke and then traveling or going to the next treatment center in order trauma and stroke center in order to receive the right treatment. Now this mobility, this movement showed a lot of pattern that did not make any sense and did not add up. Patients don't use the ambulance. This is one thing that we let the Ministry of Health learn. Patients do not use the ambulance, they use their private cars. They go to the furthest hospital and they do not go to the closest hospital to their homes. And I had an experience with my grandmother. She died 3 years ago because they said they called the ambulance when she had the stroke, and the ambulance took her to the nearest hospital, which was ill-equipped. And it's a tragedy that you cannot save time by allowing those patients to go to the right equipped hospital that is near to their home. So that's the second project that we're helping decision makers make in that sense. The third project that I'm working on is building a blockchain for emergency medical services and disaster victim identification, both as two different teams caring for a victim in a disaster. The idea is that when it comes to healthcare professionals, emergency medical services, they allow them to send medical data to save the patient on site, a victim in a disaster. Now, when it comes to the missing people, we generate missing persons list automatically after identifying a disaster. What we do with that, we allow the ante-mortem data, which is before they were dead, okay, with the post-mortem data that they collect. Most of the solutions today, you do not provide the ante-mortem because you don't expect the victim to become a victim. So we prepare for that, and we allow people to provide their ante-mortem and post-mortem in multinational disaster. So we allow the systems to automatically, using blockchain, compare ante-mortem and post-mortem data to identify any John Doe that is not been identified in a disaster. Normally it takes months to collect ante-mortem data from another country, and you need to collect it from family. Now this can be done in minutes instead of months. So that saves a lot of time and gives closure to the family for grief.
Excellent, thank you. Dr. Jiang, tell us about how you see blockchain being used in infrastructure today.
Yeah, so when talking about the healthcare, it's a really multi-level of players. We're talking about the patient is the center of the whole system. And then you have a service provider, you have a physician, you have a hospital. And then you have a supply chain. So it's from doesn't matter if it's the drug itself or the device. And then you have a regulator. So it's a multi-level of player, and we've already talking about the blockchain application in the supply chain, trace, counterfeit, the drug. It's a really very obvious in the logic application of blockchain. On the other side, people talking about the clinical trial, how those information in a secure, confidential way. Apparently, blockchain is fantastic. But I'm not, because of the personal background, I spent so many years in the industry, basically the biopharmaceutical industry. And so I consider it as a part of the ecosystem in the manufacturer distribution related particular area. I'm trying to discuss and open mind how to apply this new technology in that particular area. And so we often see people say, well, particularly in the big pharmaceutical company, it's a silo. It's not only management, but also information, almost everything. It's in a silo manner. And so there's a serious internal consideration. It doesn't matter which company, they always have this kind of a phenomenon. And so we sometimes talking about centralized and decentralized. It's a centralized not only management, but also information. It's a centralized. And the decentralized, I cannot say opposite, but in the way of managing the information and the structure, operation, all the R&D, in a decentralized manner. And so what I saw this is now, I cannot say it's the very first time, it's in a private blockchain within the company, and now provide at least one choice, maybe an even better choice. At least at the level of data or information accessibility perspective. So it become integrated. Of course, it's not solve all the problem because the data itself, for example, the integration from data structure perspective, it's another level of integration. But simply from the accessibility perspective, it already have a tremendous impact. So that's the one thing I think within the industry, so you can do this. And out of the industry, or within the communication, within the academia and startup, for example. So that's related to something probably we call it information asymmetry. So that means related transparency. And so we all know there's a transaction between academia, a new startup, and a new startup with a big pharma. And so the technical term is due diligence. And so that's basically information gathering and the make a condition. So one day, so of course, we talked to Ted yesterday. And sometimes you don't want to have it so transparent on your own. But in the end, because the technology allow you to have a permission to whoever you want to expose. And so actually you can control that. So the technology is still very useful, but you look at how the information initiated from very beginning and has a chain history, and when to the point, the part of the due diligence, it's money can involve. If you really want to have this information, you have to pay for all the infrastructure and all the ways we collect the information. So this is one way to think of potential the information asymmetries issue between different parties. And the other things which probably most people don't talk about that because of the nature of our company. So we're talking about in the blockchain environment more related to data and data management. But I'm thinking maybe although it's a predominant application, but we may also think of in this kind of blockchain environment to create the data. So because we are the algorithm company, so we constantly create digital asset. And so we're already in cloud. And so the foundation of the blockchain technology is you're dealing with digitalized data. And so we can create in this blockchain and generate data. One obvious example is that you have so many open sourced algorithm or software trying to solve the problem. And so one way you may imagine, so you may create sort of a consensus or testing in the blockchain environment. And the people use a different open source in the cloud and create a digital solution from the blockchain as a traceable, and you cannot change. And so for the potential customer, it's a really very objective to judge. So that's what I'm imagining. So on one way, it's really manage the data, but the other side is create a new data.
Excellent, excellent. All right, Nick.
Yes.
So, Dr.
Do you want me to
Jiang,
jump in on this question as well, or?
I do, but I'm gonna direct you a little.
All right, just gonna throw me a curveball. You told me you warned me yesterday.
Here it comes. Dr. Jiang talked a little bit about public blockchains versus private blockchains. So can you talk about the difference between permission blockchains and permissionless blockchains and how you see those two different kinds of blockchains being used today and in the future?
Sure. So first off, how many people here are familiar with just blockchain technology in general beyond just Bitcoin and things like that, right? Smart contracts, you guys know what those are, right? By show of hands. All right. Just trying to get a sense of the dynamic of the crowd here. All right. So as far as private and public blockchains go, you may have heard these terms. How many of you are familiar with Hyperledger? Okay. Ethereum? Okay. So those are a couple of examples of a public and a private blockchain. In a private blockchain, you would be permissioning data. So not anybody in the public would be able to access that data, where on a public blockchain, that ledger is openly available, and you can go ahead and access that information. I think there's a lot of evolution taking place, just to kind of go off what some of my co-panelists here mentioned earlier, and that's truly what this is an evolution. So these dynamics are going to most likely evolve and change over the next few years. Now, is a private blockchain necessarily critical when it comes to health data? Perhaps. Now, there's certain pieces of data that maybe you want to have public, right? But it should be up to you as the creator of that data, right? Through your own biological database you have in your body. You're producing all this very valuable information. You should have a say on how that gets permissioned out. So we're, as an organization, we're exploring the Ethereum blockchain currently. And in the future, we intend on being blockchain agnostic. So we think that there's going to be changes that take place. The rate of adoption, I think, is going to be slow. Healthcare notoriously has been laggards when it comes to adoption of new technology. So we're aware of this, and we're keeping a very close eye on the industry. We're talking to healthcare executives. We're talking to pharma and biotech companies. We're trying to understand, the direction that they want to go in. As Ted mentioned, there's regulatory frameworks to consider. So I think forums like this are great because it's about education, it's about communication, and we're able to open up the dialogue that's going to be necessary to for lack of a better term, move the ball, okay? We have to try to get some sort of advancement and standards and consensus around some of these things to determine what's going to be the best direction, whether it be private or public, depending on the application, use case. Some of the use cases mentioned by my co-panelists, I agree. I think a lot of these are very exciting, but we need to emphasize we are in the infancy of something here. There's a lot of work to get done, right? The supply chain stuff is interesting. The R&D and biopharma stuff is interesting, right? Clinical trials. Imagine, you're a big pharmaceutical company or a government institution, and you can broadcast a smart contract and get all of the critical data that you need pulled in, and people can participate in that fashion and monetize their information. There's a lot of interesting areas that we can explore here, and I think it's a really exciting time.
Okay. So let me add to this. So one of the areas we're seeing more developments in the world of blockchain and healthcare is this intersection between blockchain stored information and AI. And you could imagine if you had a full record of all your medical history and an AI system going through that, looking through, seeing the patterns, using the latest R&D, and figuring out, wait a minute, there's a little anomaly here. Maybe there's something going on in this person or this family, and maybe we need to talk to them about their certain healthcare issues. And if that all could happen automatically, you could imagine how we could do AI-based medicine using blockchain stored data and provide even better service to people around the world. That's one area. Another area we're seeing is blockchain-based insurance. There's healthcare insurance now available through blockchain technology. It's called parametric insurance usually. And parametric insurance is really insurance where you get paid out regardless of the loss you've incurred. So if you have a certain condition, we can insure you for that condition, and we can guarantee a particular payout regardless of really your outcome. You have some risk condition, and the insurance company is willing to say, you among a pool of people, some percentage of those people are going to have this condition and need to be paid out. Insurance based on blockchain technology allows for more customized insurance, really. And so insurers are looking at this both in the area of healthcare and other areas of insurance for using blockchain technology to give better service to their customers. Let me open up the panel to some questions from the floor. Does anyone have any questions about infrastructure-based healthcare blockchain issues right now? Please.
Yeah, I'll just speak loud, right? I guess my question is more on the technological side. So they're saying that blockchain is another name for very slow distributed database system. So in terms of that, I wanted to hear comments from the panel. How do you look at that? And also, when we look at healthcare data, one of the challenges is really the size of the data. We're not just talking about gigabyte of data, but actually it's terabyte or even petabyte of data. And how do we actually store that data and make use of that in terms of blockchain? I think, and how do you think it is the correct way to do it? So
there's two questions there. Question number one is, how are we going to deal with the distributed but slow database?
Yep.
And question number 2 is, how are we going to deal with so much data?
Those are great questions. And just to kind of go back to my last comment about emphasizing we are in the infancy of this, there's a lot of innovation that will take place that will probably tackle a lot of those challenges. Currently, there are areas that we're looking at for storing data. We understand that in MRI data, X-ray data, images, these files are too big. You can't put them on a block that with 1,000 transactions equals what, 16 megabytes of data. I mean, it's too slow. You're not able to hold that type of information efficiently at this juncture. However, there are other workarounds that we've implemented, and we're still evolving as well. But for our file system, we're leveraging IPFS and BigChainDB for a somewhat of a decentralized database. There's a great team out in Munich that has Bruce Kwan over there has built a great technology. They're evolving. They're also part of the Ocean protocol, which is interesting. And we are exploring those components, including the Ethereum blockchain, mostly using the blockchain for our current version to store a hash identity that can basically verify that, yes, you can access this data that sits within BigChainDB, right? But this is going to evolve. Now, the speed of these transactions, you're right, it is slow. It's not as fast as we would like. But at the same time, health data, if you compare it to something like financial data, I mean, financial data needs to be quick. I mean, you need, what is Visa, correct me if I'm wrong, but was it 40,000 transactions per second? Am I accurate in that? Okay. So you need a high level of transactions per second in certain industries. In healthcare, in certain use cases perhaps. But I think for now, during this particular phase of building up this technology, having the conversations, getting standards put in, dealing with regulatory issues and red tape, politics. I mean, once we cut through all this, and innovation is built parallel to that with people in this room are working on, I think we're going to get to that tipping point, and we'll have some more clarity along those lines. But right now, it's about workarounds and it's trying to make it work. So.
Yeah. Can I? Thank you very much. That's really interesting, and thank you for the questions. I'll just give you one example of how different the regular database and the blockchain has changed the way we look at the involvement of patients. So in the database, I worked on the legacy system interoperability problem. I've been working on it for the last 10 years. Okay. So the first solution I came up with in 2015, before I used blockchain or adopted the blockchain technology and investigated the use of it, I was against the patient being the manager of that information, and I'll tell you why. That's because the data is not immutable. So if the patient decides to change the information, he can. But he might not have in mind or keep in mind that this is actually going to harm him. I'll give you an example, a more concrete example. In some countries, governments or the healthcare provider does not actually keep the information in a healthcare information system. Examples that I know of, India and Malaysia. So they give the patient the information. And what the patients do if they have HIV positive results, they hide it from other doctors, believing it's very embarrassing to share it and they do not need to know that piece of information. Now, when a blockchain came and I used it for the very same use case and problem, I loved it so much that I decided, or I'm very much convinced, that this is the best way and the best time to let the patient be in control. I know he cannot change the data. So in the first scenario, first example, doctors had to write codes, to write the diagnosis in codes to prevent the patient from hiding it. Makes it harder for the patient to hide information because you need a holistic view, you need to understand everything. And as a patient, you might not be eligible or knowledgeable enough to decide what's best for your health. You make the decisions, but you show what exactly the doctor needs to see. So this is one example, and I come from different, I have records in 4 different continents. I struggle to bring my own data with me. So having the distributed ledger as the main feature of blockchain as a distributed ledger technology and enables me and the doctors at the same time to have the same view of the information. And before that, it was every doctor having their piece of the story, or their chunk of the story, and they do not share it with the rest because either they don't have the time, they don't want to, okay, or policies in the hospital prevents them for. And I have examples that I can relate to, and my sisters can relate to, where the doctor refuses to give the information to the patient. So if I can see the same thing he can see, and it's all about me, and I cannot change the data, but he can get to see it, that's a wonderful way of using distributing. Coming to the slow side of it, and in my example here, I don't actually use it as a database and store the whole data. I just paint the full picture, showing where the patient have been, to be able to help those clinicians and the patient to track the continuity of care and know where the exact patient is. So the general practitioner or the family doctor will know where that patient has been. Whenever they go back to the general practitioner with any alarming symptoms, they will know what happened to the patient, instead of asking the patient to repeat themselves every single visit to tell them what happened to them. So that's a wonderful use of it. Thank you.
It's definitely a fantastic question. Technically, I really have no any insight, but my intuition, in combination of our company, I'm thinking it's a really case by case, really about the types of data you're dealing with. It's probably it's not a surprise. Let's say if you look at the immediate application blockchain in the health care industry sector, we're talking about supply chain in the background of blockchain technology. So that's a transaction. It's not very complicated data set like MRI, CT type of data. And so that's, I think, when you try to apply the technology in overall this area, you already try to identify the area probably most suitable for this technology, or at least immediate. Also, it reminds me of even the complicated data set. In which section, you may not necessarily from the very beginning, it might be wrong. It's a section you want to put in the blockchain. So I'll give you an example. And so now we have a next generation sequencing data. So you consider what kind of data you regularly store in your computer. So you probably not store at the very beginning image. Instead of the image, it's a process that is a GATC, the string, the reads. And so that in that way, you basically get rid of a lot of space considered as not necessary. And so you start with a string. And so that data has become very doable in whatever of course, the MRI, CT scan, those definitely so crucial. So that's really depends on the type of data and what the level. So very originally, or you start to process in a certain degree. And in our case, we generate a quantum data. So it's a humongous data set. But it's not installed constantly. Well, it's a transient because it's a continuous calculation, scientific calculation. So you're not, in the end, no, you start, this definitely is manageable. But in the between, that's supercomputing. And so I think it's really, when you try to apply the best scenario of the technology, you really think of what kind of data and the process you want to deal with.
Thanks.
Thank you. Thank you. Another question? Please.
Thanks for your panel.
Often when we talk about blockchain in the healthcare, we've had a lot of skepticism. And I think because the sort of conservative nature of the healthcare industry itself. But we do notice even without blockchain, right? So healthcare is moving more towards from fee-for-service based model into more value-based approach. So, and that itself, I mean, it's a gigantic task, and a lot of challenges and also resistance. How would you think the blockchain will enable or intertwine the change within the healthcare itself that is coming forward? Would that make it more difficult
or easier. And just coming to Shada's earlier comments about revolutionary versus evolutionary, right? How do you think these sort of combination of these two forces will work together?
Okay, so the question then is, how are we going to use blockchain technology to deal with this new change in the paradigm for how healthcare is provided to the patient?
Okay, so from my experience, humble experience, I've worked with healthcare professionals in Saudi Arabia, working on the healthcare with the Minister of Health, and I know the way that they're trying to modernize their systems towards a patient center, and that's the, let's say, that's the goal that they all talk about, having shared care, having patient-centered care, which is should be value-based, and it shouldn't be really based on any other interest that is specifically to the healthcare provider, but more towards the benefits that can the patient at the end of the day can get out of it. So Saudi Arabia experience, they're not very much at a leading position when it comes to the modernization, and they have the both approaches, the revolutionary and the evolutionary. But I'll come back to that. In the UK, they have an evolutionary approach because they built some of those legacy systems in-house. So they have a team who built those healthcare information systems. And when they built it, it was disease-centered approach, which was the traditional way of delivering healthcare. And it was all about collecting the information in a silo that is of interest to the disease itself, to understand the disease, to be able to cure that disease. And it's not about bringing information about that specific patient to be able to cure and care for that patient, regardless of the conditions and the comorbidity that he or she actually suffers from. In the US, it's very different. So when I look at those three different countries, three different continents, and the way that they try to modernize their systems, it's very different. There are a lot of factors of how they can adopt. So maybe they want, but it's very difficult. And it goes back to how much the government, the regulator, in all those examples, the government is the regulator. But it has very much, it doesn't have much control over the implementation of those technologies and the adoption, just because they're not the provider. So in the US, they're not the provider. So they leave that decision to the healthcare providers, and there's the competition here. In the UK, the government is the provider and the regulator, so that helps a lot. And we can see programs, the national program of having that unified medical record. But we see a lot of examples there where things has failed. So when they start with the most complete record, which is the general practitioner, which is the family doctor here. But they have a very systematic way of the way they lead the patient towards the primary, secondary, and tertiary care. Patients cannot go to secondary care without going through primary care. So that makes things very easy. They're the payers in the UK, they are the providers, they are the regulators. So that makes things very easy in order to adopt any healthcare delivery. When it comes to Saudi Arabia, they are actually three of them, but they still have private care when they have different providers there in private. And it's the majority, there's a lot of private healthcare providers in Saudi, and I can go to them. I don't have I need a referral like in the UK coming from the GP to go to primary care. So the way that they regulate things also has an effect on how the adoption of such new models of healthcare delivery is being adopted. It is extremely complex the way it happens. And in Saudi Arabia, they found out that it's really too much. So they're shifting from being a provider to becoming only a regulator. And that's another thing, because there is a lot of challenge there, and the government is trying to rely on tertiary care hospitals within the Ministry of Health to be able to manage and provide health care to a specific number of hospitals within their cluster. So they're doing a clusterization in Saudi Arabia, where they try to have a geographical location. This is the group of hospitals in that geographical location where someone else will be not providing the help that they have to report back to us. And it is not easy also to adopt a unified medical record to have patient-centered care, because in order to provide a new delivery model, you need an infrastructure that can support that. Now, having those different providers with different agendas, it's very difficult to achieve that. So I talked here, I shed light on the challenges that are actually arising because of the different types of the healthcare systems across the globe.
Thank you, thank you. Another question, please?
Okay, I have another question from the healthcare person side. So we see the strong demand and we see the marketing opportunities. We all agree that we should make the marriage happen, the blockchain with the healthcare. But you know, all the marriages started from a proposal. And we see as a healthcare person, I don't have the strong mood to say I want to propose to the blockchain person because we are an industry that needs, I guess they will talk, we need 100% reliability. But blockchain doesn't give us the reliability. On the other side, the blockchain doesn't have the strong mood to propose. We are talking about the infrastructure. I don't think the blockchain person has proposed enough to convince us that this is a ready technology to use. So I'm thinking in your mind, so who should be more proactive to make this marriage happen? That's the first one. The second question is, if that's the route that like some person proposed, then what's the biggest hurdle in here in your mind? Is that the technology from the blockchain side, or is the regulation from FDA side? So which one is actually the biggest block, like hindering the marriage so far? Thank you.
Okay, so the question is, how can healthcare and blockchain be more romantic?
More flowers.
Flowers and chocolate?
Yeah, I'll jump in here real quick. So I think, just to put it into perspective, in my own opinion, I don't even think we're in a proposal right now. I think we're just on our first or second date, honestly. I haven't even met your parents yet, okay? So, but having these conversations is important, right? And I think that the relationship between healthcare executives and the blockchain technologists and entrepreneurs of the world, quite some students that are also exploring blockchain, which is really exciting, right? So how do we bridge that gap? How do we create a dynamic between healthcare and blockchain? Well, I think the answer is having tests and pilots, right? Scaling something out right now is probably not very practical. I mean, I'd hate for it to blow up and then it becomes a divorce, right? You know what I mean? So what I think if we look at the situation, we have the conversations, we're able to educate each other. You know, healthcare can talk to the blockchain people, as Ted was alluding to earlier, and educate them, and vice versa. So if we are able to run these pilots, do the testing that's necessary, I think we're able to head in the right direction.
Comment? Okay, so I think that goes back to my last comment about having the regulator, the provider, and the payer. So if having too much control coming from the government to regulate things and roll out such projects that can have those pilots in specific hospitals and be able to control the adoption of that technology in a very controlled environment, that's really helpful, and that really could be achieved, and that helps with the bonding. But when you have the providers not being the regulators and the payers, now that goes back down, that at the very end, it's up to those providers. And if you have multiple providers with different agendas, then definitely you're going to have a conflict. And I don't think we're going to go to a third date in that sense. But just lastly, I think at the end of the day, the adoption could come up, top bottom, or it could go bottom up. Bottom up is the patient. So we're all patients, and there are lots of solutions out there that have this blockchain available for us. And the beauty of those solutions are they're free. So you don't have to pay a lot of money to be able to be a user of blockchain technology. I myself has problem recording my medication and keeping track of the names of my medication, because I need to do tests every 6 months for my thyroid condition, for example. And every single time I go, they ask me those questions, I need to keep track of them. And also, I need to keep track of the last time I did those tests and the last time the level of the hormone that happened. That's only It's only when it comes to the thyroid. Now I'm asthmatic, so I need to make sure that I do the regular tests as well for that, and I need to make sure that I take my medication on time and I don't miss a prescription. As an individual patient, I have the technology out there to help me track that. I don't need my doctor. I don't need to wait for the provider. I don't need to wait for the healthcare regulator in order to have a system that says everyone needs to use that, or the healthcare provider needs to use it and tell me as a patient that it's available for me. I can use the technology available out there. I can make the maximum out of it, and I can use it, and I can request my information and store it there. That's available for us today. So if we start from bottom up, I think we're going to reach somewhere. And I'll give you just an example. I know the time's up. It's just the GDPR regulation, the new European regulation. It gives you an example of how things are moving towards users having control. And that movement started in 2011. Today we see the fruits of such movement. And I think that's going to happen in healthcare if we move as patients to do that.
Dr. Jiang, last closing remarks, please.
Yeah, I think it's from date to marriage, and so you can date quite a lot, but married, probably not many. So that's back to the example why the counterfeit or supply chain is a very good application. It's multiple players, common interest. From supplier, from manufacturer perspective, they want to be sure the drug is step by step into the patient. The service provider think, well, yes, I prescribe it. I want to the pharmacy give the right drug. It's a traceable. It's a real drug. It's not a counterfeit. So and also the payer, of course, I pay for this. I want to pay. It's a generic, authentic drug. It's not counterfeit. So again, that's a sweet spot. So identify the good project or area of application. I think it's more important. That in the end, you can get a marriage. That's my.
Very good. All right, I want to thank the panel.
Guys, we're going to move on into a affair that has a little bit less romance than this past panel. It's a bit of a coffee break, so please grab some coffee. We have 5 to 10 minutes. Say hi to your neighbor. Make a joke about the third date.